Hey guys, let's talk about Ondansetron, also known as Zofran. This is an injectable medication, as you can see here. The therapeutic class of Ondansetron, or how it works in the body, is an antiemetic. The pharmacologic class, or the chemical effect of Ondansetron, is a 5-HT3 antagonist. So Ondansetron blocks the effects of serotonin on the vagus nerve and the central nervous system, which is why we use this drug for the treatment of nausea and prevention, and also for vomiting. Some of the side effects that Ondansetron can cause are things like headache, constipation, dry mouth, and diarrhea. So in rare cases, Ondansetron can cause extrapyramidal symptoms. So be sure to assess your patient for these. And also you want to assess your patient's nausea and vomiting to be sure they're only receiving the amount necessary. Also monitor your patient's liver function tests. And it's important to administer Ondansetron slowly over 2 to 5 minutes, because rapid administration, guys, can cause fatal QT prolongation, VTAC, and respiratory arrest. And it's important to teach your patient to report symptoms to the provider. So the maximum recommended daily doses vary depending on why your patient is receiving Ondansetron. So, for instance, chemo patients tend to receive a higher dose than post-surgery patients do. So, just be aware of this depending on which area you are working in.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.